Hey, good morning. It's Patricia Murphy. It's Wednesday. This is Seattle Now. About 70% of eligible people in Washington have gotten at least the first shot of a COVID vaccine. But that leaves almost a third of the state unvaccinated.
I have nothing against the vaccine. I mean, I think about getting the vaccine, but I just feel like I want to wait a little bit longer.
We'll hear from unvaccinated Washingtonians about what's holding them up and what it would take for them to get a shot. But first, let's get you caught up. Governor Inslees wants vaccinated people to consider masking indoors. That's in line with new federal guidance and a response to increasing COVID rates. People who are unvaccinated are still required to wear masks in indoor public spaces, so no change there. The governor also says students will be wearing masks next school year. And a prime example of COVID spreading in public places, at least 9 bars around the city had to temporarily shut down after workers tested positive for COVID. Seattle Times reports the Unicorn on Capitol Hill and Jupiter Bar in Belltown each had 2 workers who tested positive over the weekend. The owners say the rest of the staff were negative, and both will reopen in a few days. And can you remember the last time we had a good rain? Let me tell you, Seattle hasn't had what the Weather Service calls measurable rain since June 14th. As of today, that's 45 days without rain. We're just over a week away from breaking the 2017 record, and it might happen. The National Weather Service says there's a chance for some showers on Sunday, but probably not for the city. Governor Inslees is recommending that people mask up indoors again, regardless of vax status. COVID cases are ticking up again for the first time since vaccines opened to everyone over age 12. And while some vaccinated people are getting sick, the majority of cases are in people who haven't gotten a shot. The Department of Health is ringing the alarm bell. It says vaccine rates can't keep up with the virus. KUOW reporter Eilis O'Neill has been out talking with unvaccinated people about why they haven't gotten a shot and what it would take to get them there. She's here to tell us what she found. Hi, Eilis.
Thanks for having me.
So, Eilis, for this reporting trip, you went out to Walla County in southeast Washington, which is having a significant number of COVID cases right now. Tell me how they stack up to the rest of the state.
At the time I went, they had more COVID cases per capita than any other county in the state. In King County, about 7 in 10 people are vaccinated or have had at least one shot of the COVID vaccine. In Walla, that's only 5 in 10. They are doing well compared to Eastern Washington, which the public health officer of Walla really likes to emphasize that compared to most of Eastern Washington, they're slightly more vaccinated, but compared to places like King County, they're very under-vaccinated.
Okay, so there's clearly work to do in Walla County to get more people vaccinated, and this was one of the things you were exploring. Where did you go to try to suss out this story about where people were about vaccines?
Well, I started at the Border Tavern. My goal was, where do the locals go? I don't want to go to where are the, tourists from King County who are in Walla drinking wine. Where are the people who live here? And the Border Tavern, it's just a shack in the middle of a gravel parking lot. Mine was the only vehicle that was not a pickup truck. And I walked in the front door and everyone turned and stared at me like, what are you doing here? Did you get lost? Are you trying to be at one of the bars downtown and you somehow ended up here? And I went out to the patio, which was just a fenced off. It had a kind of chicken wire fence around a part of the gravel parking lot with a couple of picnic tables on it. And I just started talking to some guys who were out there.
Okay, so you show up at the local bar.
Yeah.
And you get 3 guys who are unvaccinated to sit down and talk with you a bit. What did you learn? Who did you talk to?
The main one was Jesse Garner. He is a construction worker. He's 47 years old. He's not vaccinated because he got really sick after his ex-girlfriend convinced him to get the flu vaccine 10 years ago. And he would rather take his chances with COVID, the disease, than with any fever or anything associated with getting the vaccine. And he also told me he did not want to give in to peer pressure and get the vaccine.
I'm just not gonna go down and take a shot because my buddy told me to take a shot. Let's go do it. Come on, man. Let's stop the virus or whatever and do it. Take a shot. I've already did that with the fucking flu, and I got sick as a dog. I'm not gonna do that again.
Is there anything that would make you change your mind about vaccination?
Probably my son. My son would be the only one that talked me into it. If he says it's good, then I gotta do it.
Eilis, I'm guessing at this point his son has not approached him to be vaccinated. So Jesse is a little bit of a tough guy. He doesn't want to be told what to do. And he has also had a negative vaccine experience with the flu vaccine. And this is something I've heard before, right? What does this say about people who are unvaccinated like Jesse?
Well, one thing that's interesting is he says he doesn't want to give in to peer pressure and get the vaccine. But at the same time, he told me most of his coworkers are unvaccinated. His son is unvaccinated. His girlfriend is unvaccinated. And so he's just part of this social circle where the low resistance thing to do, the path of least resistance, is to not get vaccinated, versus in a place like Seattle where the social pressure, the peer pressure would be, you need to get vaccinated. Why are you not vaccinated yet? What's going on?
This really is a flipping of the script that we have around here because, like you said, to not be vaccinated here is something that a lot of people feel like they have to justify, whether they want to talk about it or not. But it sounds like in Walla Walla County, it is just the opposite. One thing I hear a lot is that people just have questions. They're not necessarily anti-vaccine. They just need more information. Did you meet people like that?
Yes, I met this woman named Claudia Reyes, who is the manager of a popular Mexican restaurant in Walla Walla. And she told me that she just has a lot of unanswered questions about the vaccine.
The thing that I have question to is like the long-term side effects of this. Like I don't think any of us know. And to me the other question is the people who have gotten it, like right now we have our hospital full. I'm curious to find out if those people had the vaccine, what kind of vaccine. Was it the first time, the second time? Did it help that much? Did it not? I just have that question. I'm not sure if they put that information out for people to know, which I think would be helpful.
That information is out. You can get that on the DOH website. They have...
And I couldn't help myself because I knew the answers to so many of her questions. I just started answering them.
So you were answering her questions. Did she seem to change her mind after you talked?
Maybe. She said that she was more comfortable after knowing a little bit more about the vaccine and that she would probably seek out more information to finish answering the rest of her questions.
As I'm learning things, I think it would make me maybe say, yes, I do want to go get it. You know, like these things that I'm just finding out right now that I didn't know, and maybe more information that I want to know. Like you just told me that you wouldn't be able to spread it as much as if you didn't have it. It's good to know because we just have the thought that, oh, you can still give it to somebody else. It's only protecting you from getting the symptoms and not really saying, oh, it's helping you so you won't be able to spread it as you would if you didn't have it. See, I don't think a lot of people know that.
You know, Eilis, what's interesting to me about this is that you managed to create a dialogue that had not been previously available for one reason or another to this woman and moved her closer to a point of comfort about getting vaccines. And it really makes me wonder what Walla Walla Public Health is thinking about and how they're approaching this, because it's clear that some people in the county are dead set against getting a vaccine, but there are others just like Claudia who just need a little more information.
Yeah, so after talking to a bunch of unvaccinated people in Walla Walla who seem like they could be convinced, like Claudia Reyes could be convinced. I think even Jesse Garner, who says his son could convince him, could be convinced to get the vaccine, especially if he had more information about side effects. So I asked the Walla Walla County Public Health Officer, Dr. Daniel Kaminsky, what is his plan for communicating with these people? What programs does he have in place to reach people who are on the fence in Walla Walla County? And he told me he doesn't have one.
Everything's been out there. everything on every side of the issue, good and bad, true and false. And people have their belief systems, and sometimes I sit around like, what was one thing that I would say that would change their mind? And I'm not convinced that I have that ability and power to do that. I think if I had a loud, forceful message, some people would be very happy with that. Like, yeah, it needs to be said, but it's going to push those people further away from me, and then we have no chance.
Eilis, I'm very concerned that this is a public health official who seems to have given up on convincing the people in his county that vaccines are not only important, but critical to fighting the COVID virus.
It's a really different approach from, say, Dr. Jeff Duchin here in King County, who has really active programs to work with communities, understand what people's concerns are, meet them where they're at, and answer any outstanding questions that they have, or try to solve any logistical questions or problems they might have that are barriers to getting the vaccine.
Obviously, these two areas are taking very different approaches. My question then, looking forward here, cases are going up. The Delta variant is now extremely prevalent in Washington. And just yesterday, Governor Inslee recommended people mask up again indoors, even if they're vaccinated. How might the governor's recommendation change how things are going in Walla Walla?
Well, when I spoke to business owners, they told me that one of the ways they got people to wear masks in their businesses was they said, I know it's so annoying to wear a mask, but Inslee, it's the rules. We have to. Here's a mask. Please put it on. And that directive at the state level kind of created cover at the county level to enact an unpopular policy. And when I asked Dr. Daniel Kaminsky, the public health officer in Walla Walla, would he consider a new mask mandate given where cases are in the county, he said, not unless there's an overwhelming consensus in the county to do so. And I wonder if Inslee's new directive at the state level will provide that political cover to start increasing the level of masking in Walla Walla and blame it on the governor.
Blame it on the governor. It'll be interesting to see because, right, it's not a directive, it's just a recommendation. So maybe, Eilis, ultimately this just confuses the message in Walla Walla and really just divides it right down the middle.
Yeah, we'll see.
KUOW COVID reporter Eilis O'Neill, really appreciate you bringing us these stories. Thanks.
Thank you.
Thanks for spending time with us today. If you want more Seattle Now, follow us on Instagram. We're at Seattle Now Pod. Clare McGrane produced today's show. Our production team is Caroline Chamberlain Gomez, Diana Opong, and Jason Pagano. Matt Jorgensen does our theme music. I'm Patricia Murphy. See you tomorrow.